Dr. Kristin Szuhany. Welcome to the Mental Wellbeing College.
Excited to be here. Thanks for having me, Indy.
Yeah, it's absolutely fantastic to have you on. We've had many conversations with past guests about the benefits of exercise for mental health, but to discuss how we can implement that in a therapeutic space with a psychologist, a clinical psychologist, a researcher such as yourself in this space, I think is a fantastic opportunity. And before we dive into the weeds, Kristen, love to know a little bit about that background of yours, how you got into this space, especially given your background as a practitioner and researcher.
Yeah, absolutely. I mean, I can start all the way back in my childhood, which
Yeah,
is
the origin
maybe
story.
where everything starts for people. But for me, my family would always go on summer vacations that would follow the New York Yankees. So that's a baseball team in America, for those who don't know, who sadly lost the World Series this year. But
Oh no.
um, we're big Yankees fans, so all our vacations would be built around going to different baseball stadiums, seeing the Yankees there, and then going to the historic sites in the area. But growing up with that love of the Yankees and the love of sports, I started to be really interested in sports psychology, actually, to start.
Okay.
So, and particularly in how performance anxiety shows up for people in sports. I played softball in high school, and I certainly experienced that performance anxiety getting in the way.
Yeah.
Um, so when I went to college and was interested in psychology, that was kind of like the first perspective I was interested in. I did a thesis project on clutch performance in Major League Baseball. So it allowed me to just watch a bunch of baseball games and code things. And found that Derek Jeter, New York Yankee, beloved New York Yankee, was a very good clutch performer. Um,
Right.
but that then kind of turned, and then I got into some research in anxiety disorders and cognitive behavioral therapy. And then ultimately found myself in grad school with Michael Otto, who does a lot of exercise research. So it's kind of this like marriage between my interests in clinical psych and anxiety and helping people with anxiety disorders, and also this love of sports, which I still have. And I'm our sports liaison here at NYU, sports health liaison. So it was like a kind of a happy marriage of all of my interests that got me into being an exercise researcher and a clinical psychologist at the same
Yeah.
time.
Wow, I love that. So from the New York Yankees to softball to performance anxiety
Yeah.
to now exercise and mental health. Fantastic. And obviously, you've done, like you said, a lot of research in this space, particularly the exercise and mental health space. Done some cool work with Michael Otto, and talk to us a little bit about some of that work, particularly looking at the benefits of exercise for mental health. So it's something we've covered it in past episodes, but I
Mm-hmm.
think particularly for new listeners who may be tuning in, it'd be good to get a bit of a snapshot and overview as to exactly how exercise can help our mental health, Kristen.
Yeah, absolutely. I think it's no surprise probably to people that exercise does well for our mental health and our physical health. But we also know that in the research too. So cross sectionally, meaning kind of like if you assess people at the same time point, we see that people who are exercising more tend to report being less depressed, less anxious, less stressed, just higher levels of well-being, even social connection with other people. Um, and then we also know that exercise interventions work well for people too. And particularly, there's been a lot of this research in exercise for depression. So people who have major depressive disorder, for example, or even depressive symptoms. Your previous podcast guest, Dr. Felipe Schuch, does a lot of these meta-analyses where there's tons and tons of studies on depression. And really, we see some really good effect sizes, meaning that exercise does well to improve depression symptoms for people. There's a little bit less in the anxiety world, which is part of the reason that I've kind of put a lot of focus in my recent studies on people with anxiety disorders. But some of the research there also shows that exercise interventions can be really helpful for anxiety. There's a decent, good chunk of evidence for PTSD in particular, a little bit less studies on things like generalized anxiety disorder or social anxiety disorder. Um, and then also that some kind of new research coming up in more serious mental health conditions like schizophrenia, substance use disorders, that exercise can work really well. We know exercise can help with our brain health, improve our cognition, attention, memory, cognitive functioning, and sleep. That's another thing that underlies a lot of these mental health conditions. I just recently was part of a narrative review on exercise interventions for sleep in psychiatric populations.
Ah,
Surprisingly, not a lot of studies looking at
wow.
exercise interventions for sleep in these populations. So that's a
Okay.
call for more research, maybe in that area.
Yeah. That does surprise me, given it's often used as like one of those sleep hygiene
Mm-hmm.
behaviors. So yeah, interesting, interesting. I'm having Giselle Passos. I don't know. You might have even come across that name. Exercise for chronic insomnia. She's coming on the podcast in a few episodes. So yeah, it does seem to be a growing space. But I appreciate that overview because there is like you said, a lot of evidence for a lot of different disorders.
Mm-hmm.
I'm curious, does it surprise you, or did it surprise you when you first came across this, to know just how strong the evidence is? Like you said, there's large effect sizes. There's in Australia, in Europe, some of our clinical practice guidelines are that exercise should be used by health practitioners as a first line treatment with therapy. Like, does it surprise you just how strong the evidence is, or as a softballer
Mm-hmm.
yourself growing up, no, you kind of knew that intuitively the whole way?
Yeah. Well, I think a lot of people intuitively can feel that when you ask
Mm,
them, how does it feel when you exercise? A lot of people say, oh, I feel better when I'm exercising, or I feel worse when I'm not
mm,
exercising. So I think intuitively it makes sense. But I think to see it borne out in the actual effect sizes, so like our statistics,
yeah,
it's pretty interesting to see that really, it's doing just as well as some of our gold standard treatments, or things that we've considered for years and years gold standard treatments, like cognitive behavioral therapy or other psychosocial treatments, or medication, for depression or anxiety, um, which also, these things come with side effects. Medication comes with, and therapy can also be hard to access for people, especially good evidence-based care with, somebody who's well trained. So it's nice to see that something like exercise can do just as well, and maybe be more accessible at your fingertips to be
mm.
able to actually help with these conditions.
Yeah, that's so true, right? That accessibility piece, because even in developed countries like Australia, I'm not overly familiar with the state's mental health care system, but I'm sure there are similarities. But there are huge waiting lists for
Mm-hmm.
therapists. To try and get in with a psych like myself can take months. Then, like you said, medications can have particular side effects, but it can also be expensive. So
Mm-hmm.
exercise can be very accessible, right, and can overcome some of those barriers that you outlined.
Yeah, absolutely. And it's similar here. I know
Mm,
within our clinic here, there our kind of clinical practice here, the wait list is months long, and it can be really challenging to for people to get the help that they need. So having alternative options that we know work
mm.
just as well, is good.
Yeah,
And it's
yeah,
nice to hear
definitely.
also that exercise is listed as a first line intervention in Australia. I don't know. I'd have to refamiliarize myself with the US, though they don't really come out with a lot of practice guidelines here for mental
Yeah,
health all that often. Um,
yeah,
but I don't think it's quite listed there yet, but it should be. I agree with
yeah.
you.
Well, I was actually, I think it was APA, but I always conflate the American Psychological Association with the American Psychiatric Association. So it was one of them, and it was like 2010. So this was 15 years ago, right? And as you know, the field has evolved dramatically
Hmm.
since then. But I remember reading like where exercise was in the clinical practice guidelines for mood disorders, and it was listed like it was a tiny little bit, and it was
Hmm.
listed as like an alternative therapy, which essentially the message was you can try it if nothing else works.
Right.
Whereas I don't think, as I'm sure you know, that's not really aligned with the veracity of the evidence for exercise and mental health.
Exactly. Exactly.
Yeah,
So
yeah,
we got to catch up. And I mean, I guess
yeah.
there's also been a lot of research in exercise interventions since then to really
Mm,
showing how well they're
yeah.
doing too.
Yeah, from people like yourself, which I definitely want to get into. So And the bulk of the conversation, I think, will be spent here in terms of what it might look like in the therapy space,
Hmm.
Kristin. So yeah, really keen to dive into this, given especially, like you said, your research background, but also your background as a clin psych. So you can take this wherever you want to, but what would exercise in the therapy space with a psychologist look like?
Yeah. So I think it can look a couple of different ways. There's two lines that I'm also exploring, both lines in my research, I would say. So one
Mm,
is, how do we just kind of motivate people, get people to exercise as, part of a treatment plan for people who have anxiety or depression symptoms. But then the other line, which is a bit of a newer line of research, is, can we use exercise to augment exposure therapy? So I think I'll start there, since that one
yeah,
has
yeah,
less behind it quite yet.
good.
And that's part of
Yeah.
the reason you see this like treadmill, if anybody can see that in the background of my office, is for a study looking at how exercise can augment exposure therapy. So we're really in the research and baby infancy for understanding this. But there are a lot of studies actually in animal models that show that animals, so usually rats or mice, that go through a fear conditioning and extinction paradigm. So this is where you're conditioning them to have a fear, usually of a shock in a cage of some kind, and then you extinguish that fear. So you have them in the cage without the shock coming up. Um, that if you have them do exercise right after that extinction phase, then they remember that better. So they come in and are less afraid, showing fear behaviors when they come back into that cage a day later. And this kind of fear conditioning extinction is meant to map on to how people develop anxiety disorders, or PTSD, where we fear a certain stimulus. And then in exposure therapy, we have them practice being in the context of that stimulus without the negative consequences happening. So for social anxiety, people might fear giving a speech, so we have them give a speech over and over and over again. So we extinguish that fear. So there's really good evidence, actually, like really large effect sizes on the order of like 0.9 or 1, which are pretty high
Yeah,
in
wow.
our psychology world, that show in the animal world that exercise can really help with this fear extinction. We're just kind of starting to translate that over into humans. So there's been a lot of good work from Kevin Crombie and Josh Sisler's group in PTSD. And so they've kind of done this paradigm in humans, the fear conditioning and extinction paradigm, and had people who have PTSD, mostly women with PTSD, exercise after extinction. And they found that it helps reduce threat ratings, so how kind of scared they are of the stimulus, and also that they're less responsive in reinstatement, which means when you give them a shock unexpectedly, that they have less reaction to it, fear reaction to it. And I'm trying to do this in people with anxiety disorders. So that's what this treadmill is for, so that people
Yeah, wow.
either are running on this treadmill for 20 minutes, or they're just sitting in a chair as a control condition after they're going through this similar paradigm. That's in process, so I don't know the results of it quite yet.
Yeah.
But if this stuff works, then the next step is to put it into exposure therapy. So if you're doing exposure therapy and you have somebody who's gone through a good exposure, they've gotten good learning, they've done their speech and they realized, oh, it wasn't as bad as I thought it would be. Then you have them, do a brisk walk on a treadmill for 20 minutes. And that will hopefully, is what we're going to show, can make that learning consolidate faster, and hopefully make our exposure therapy a lot stronger and a lot faster for people too. So that's the goal. This has been done so far, I think, a couple of times. Mark Powers did this in a small study of people with PTSD and found some good effects, adding it to prolonged exposure therapy. But we're kind of in that first stage of the translational model, and hopefully we'll get over to adding this to actual therapy if it works soon.
Yeah.
So that's one way I can see how we can use exercise in therapy. We just have our treadmills in our office, maybe a little exercise bike in the office. And if they do well in their exposure, get them on there for 15, 20 minutes to help
Yeah.
them learn.
Yeah. Well, let's double click on that. That's really interesting, novel work by the sounds of it, and particularly in humans in clinical trials. So, what's the mechanism here, the hypothesized reason why exercise helps with exposure therapy? Because I think prima facie on the surface, they seem even to me as quite disparate
Mm-hmm.
ways of achieving the same outcome. So how do they work together?
Yeah, so there are a lot of different theories. We haven't fully figured out the mechanism quite yet.
Yeah.
But Kevin Crombie's group also found they took some blood samples when they were having people do this exercise
Yeah.
and found that BDNF, so brain derived neurotrophic factor, which is this neurotrophin in the brain that is associated with growth of the neurons, so the little cells in our brain. It's associated with also developing more connections between the neurons in our brain. It's associated, it comes in our hippocampus, which is like our memory center of our brain, our little learning center of the brain.
Mm.
They found that BDNF actually increased. So we know BDNF increases after exercise, and they found that BDNF was associated with better learning too
Mhm.
in these situations for the women with PTSD. So it's possible that that's kind of one biological mechanism, that it's this enhancement of learning, basically. So this has been, I think, a quest for therapy researchers for a while to find learning enhancers for exposure.
Mm. Yeah.
I was involved early in graduate school with looking at D-cycloserine or DCS as a potential learning enhancer and augmentation. So we think that maybe exercise is acting on our learning space, potentially through something like BDNF, to just enhance that learning. There's also been some studies that have shown that if people either don't learn well from the extinction, or are, if you're putting it after conditioning, so then you're kind of pronouncing the fear learning, then it doesn't do well to help
Okay.
with
Yes.
reducing fear for people. So it might be a learning mechanism, like if we're just kind of upping learning, whatever the learning is, good,
Mm.
bad. So we want to make sure that we're when we're testing these things, that we're also applying them in situations of good learning, which was also, I think, what happened with DCS kind of falling short a little bit, that if you administer it in any situation, sometimes people don't do well in exposures, and it enhances that learning too.
Right. So the idea here is if you have a feared stimulus, so I'll take an example. I just moved to Queensland, which is a state in Australia, which is wonderful, beautiful, but has a lot of creepy crawlies,
Ah,
a lot of
yes.
big spiders. So, and I am actually trying to practice exposure therapy to said spiders.
Yes.
So potentially, if I did my exposure therapy of being in the same room as a big, hairy brown huntsman spider, but that was a positive experience in the sense that I took away, yep, that was okay. I was able to
Hmm.
be with that spider and then exercise straight after. That may enhance my ability to now learn that it's okay to be around
Hmm.
the spiders as opposed to, no, they're scary. I can't deal with them. I need to avoid them all the time. Is that
Ex-
where you're coming from?
exactly. Yeah. So we want to enhance that, whatever the key takeaway is for the person after the exposure. So often when we're doing exposure therapy, the biggest and most important part is the debriefing. So what'd you learn from that? What did you take away? So if you took away, oh, that spider is not so bad. It's actually pretty cute, right? I can, hang out with a spider and it's no big deal, then
Mm.
that's great. We should exercise after that and get all that good learning to remember, the next time you're in the room with the spider, oh, yeah, I remember this wasn't so bad. It's kind of cute. I can do it.
Yeah.
But if you were to be in the room with the spider and you were like, oh my God, this is horrible. I hate spiders. It's probably going to bite me. Oh, it bit me, right? Those types of takeaways. if we did exercise after that, we'd probably solidify that learning, right? So then the next time you're in the room with a spider, your learning would be, oh my God, it's horrible. I would never want to be in a room with a spider again. So that's where it gets a little tricky. And again, we haven't totally solidified all this evidence that exercise actually works in this sense.
Yeah.
But if that's where we go, then we would want to apply it to quote unquote good learning, but not when we had situations of not so good learning.
Yeah. Well, I love that as well, because I mean it speaks, I think, more broadly, right, to the idea that exercise has all these wonderful benefits, but can also go wrong, and there are potentially some conditions where, or some instances where we may, as a therapist or as any healthcare practitioner, not want to use exercise to treat. For example, if someone has body dysmorphic disorder or an eating disorder, there are instances where we need to be a bit more cautious, right?
Yeah, absolutely. And in a lot of our research studies, we would, on the research end, right, exclude people who have certain eating disorders like anorexia or bulimia, because it's just much more complicated when we're recommending exercise. Not that you can't, but you want to be careful the motivations that you're feeding into. And then similarly, there's mixed evidence for bipolar disorder, particularly manic states, right? That more activity, more exercise might not necessarily I wouldn't say induce a manic state, but it might be associated with mania. But we know that there's depression there. So there is a balance to strike, and just more to be learned, I think, in some of these spaces too, because there's a little less research in those conditions.
Hello everyone, a quick break from today's episode. At the Mental Wellbeing College, we are committed to the goal of communicating evidence-based wellbeing strategies out to the broader community. The goal of this podcast is to bridge a gap between self-help material and peer-reviewed research by providing evidence-based discussion that respects the nuances of psychology, but is digestible for all audiences. Ultimately, I hope that you as a listener feel empowered after each episode so that you can take away and implement strategies to improve your own mental well-being. If you have gained value from this episode of the Mental Wellbeing College, I would be so grateful if you were to hit subscribe or follow, or to share this episode with someone that you love. This is how we continue to grow the show, get the message out, and to impact people in need by providing such information and strategies. Thanks so much for tuning in. It means a lot to us here at the Mental Wellbeing College. And now back to today's episode.
Well, very exciting, some of the work that you're doing there with the exposure therapy. Now, you did mention there are two major ways in which you implement this. So what's pathway 2, Kristin?
Yeah. So the other pathway, I would say, is, just integrating it as a part of your treatment. Right. And this might not be, it could be integrated, standalone, because we know exercise alone can help with depression or anxiety or obviously other things. But also if you're working on other techniques, within the context of cognitive behavioral therapy or other sorts of therapies, recommending exercise alongside of those things can serve to augment those therapies as well.
Yeah. So tell us a little bit about what that looks like, because I know you did, I think it's part of your thesis. I got my hands on your thesis somewhere and read through most of it. So what does that look like, particularly with the side of things where it might be used adjunct or alongside a therapy? Because correct me if I'm wrong, but you looked at that with behavioral activation, or maybe versus behavioral activation?
With behavioral activation, yes.
Okay.
You're right. So it was a brief behavioral activation treatment plus exercise, and then the control condition was plus stretching. The spoiler alert is that both did just as well as increasing exercise. But I guess to back up before even talking about how this would look, I think one thing to note is that a lot of there's research on this, that a lot of clinicians, mental health clinicians in particular, providers, report that they're kind of hesitant to recommend exercise as part of their treatment. And I think that's an important thing to address. And, part of that, some of the reasons that are mentioned are, just not having training in, recommending exercise, not knowing what type of exercise to recommend or would be best, worrying about safety concerns or maybe comorbid medical conditions, or even maybe like feeling like they're, pushing people to do something that they might not want to do. So yeah, those are all, valid concerns, I would say, but a couple of ways to address this, maybe in our own restructuring of our thoughts. I think one, if it's concerns about comorbid medical conditions, we consult all the time, right? We consult with our medical colleagues, our, psychiatrists on the medications that, they're providing. So if you're concerned, consult with a doctor on this stuff too, right? Like that, I think that shouldn't be something that creates a barrier to treatment, because it's we try not to make it a barrier to them, getting adjunctive medication. So why not adjunctive exercise as well? But then the other thing I think is just, can we reframe what our purpose is in helping people to engage in exercise? We're not, and I'm a clinical psychologist. I'm not an exercise physiologist. I'm not a personal trainer. I'm somebody who likes to exercise myself too, but I'm not trained in, how to deliver exercise in the similar way to, all these people. But our expertise as clinical psychologists or, mental health providers is in motivation. We know how to motivate people to do stuff, right? We know how to motivate people to engage in exposures, which are uncomfortable and not things people want to do. So we can motivate people to exercise. And really the biggest barrier to people exercising is getting there, right? The motivation to actually do it. So if we can reframe and see that that's our role as a mental health provider, is to help with the motivation to get there, not necessarily saying you have to do X, Y, or Z type of exercise, then I think it can really help us to feel more comfortable and confident prescribing exercise for mental health.
Yeah, love that. Love that. Yeah. And I think completely agree, right? In the sense that we're not exercise professionals, but we have, I dare say, much more training on how to change health behaviors than any other health professional, doctors, exercise physiologists, etc. In terms of, like you said, motivation, health behavior change, what underlies that. And also I feel like the therapeutic space, having that, relationship where you've got the time, but also like a very deep relationship where you can overcome some of those barriers someone may be experiencing going through exercise, and you've got perhaps the time that a doctor wouldn't. You've got the trust with your patient if you've got a good alliance. So there are, I agree, right? There are lots of reasons to think why psychologists and we as psychologists can't use it, but there are just as many unique facilitators as to why we are perfectly placed to promote exercise in some circumstances.
Yeah, absolutely. And I think, to your point too, a PCP might, prescribe exercise, but then when's the next time you're going to see them? Probably like in a year, right? And they'll check in with you about how your exercise went in this past year. But we're typically, seeing our patients, working with them on a weekly basis. And we know that one motivation strategy that works really well is accountability, right? So if somebody is accountable to you, and they know you're going to be checking in with them and also helping them problem solve obstacles that came up in real time, instead of waiting a whole year to say, oh, X, Y, or Z, got in the way of me exercising, then we can do it, a little more frequently to really support people to overcome some of those barriers, especially when you're starting up an exercise routine. Stuff comes up, right, before you can get it to be a habit. So having somebody there to support you who, again, knows how to motivate people to get over these barriers is really useful.
Yeah, and it's so important, right? Because it comes back to, I think, what you said right at the very start about most people already know exercise is beneficial. So the issue, what they don't necessarily need is just a healthcare practitioner telling them, hey, you should exercise, it's good
Hmm.
for your mental health. But it is, like you said, that motivation, that health behavior change piece of, okay, how do I go from an intention to making this a consistent, sustainable behavior, which in often many cases they've tried so many times before, but potentially with that accountability with someone to guide them on a
Yeah.
weekly consistent basis can make all the difference.
Absolutely. And I think that's where, if you are choosing behavioral activation as an intervention for your client, that's a really nice framework to integrate exercise into.
Hmm.
Because behavioral activation inherently, it's a treatment often used for depression, most often used for depression, right? Because the idea is to get people to engage in meaningful, valued activities, because when you're engaging in things that are meaningful and valued to you, inherently those are just going to improve your mood and make you feel better, make you feel less depressed, right, and less uninterested or anhedonic. And there are multiple different domains of things that you can focus on in behavioral activation, but ideally you want to get people doing things across lots of domains of life. So focusing on, how can I engage with things that are meaningful in relationships or in work or school, or in my day-to-day activities or leisure time hobbies, or for my mental and physical health too. And so exercise is, if people identify that as something that they would value and they see as a goal for themselves, it is important that you don't, place that upon them, because there's already a lack of motivation to exercise. If people aren't identifying that as a goal, then you're really going to be in for an uphill battle. But most
Yeah.
people, like we said, will say, exercise is good for me. I know it helps my physical health, my mental health. I want to do it, but I just can't get there. So if we can put that as a goal with our behavioral activation, we can also work towards that. And interestingly, what I found in my study, so the people who were in the stretching group weren't allowed to put exercise as a goal for their behavioral activation,
Yeah.
but they just did it more. And I think that's just the context of behavioral activation too, just gets people moving more
Yeah.
also. Because if they're, trying to do other goals, like maybe going to visit a friend, that might entail walking over to go see the friend, or maybe even taking a walk with the friend. So behavioral activation, we kind of concluded that in and of itself might just increase activity. We also had people who were probably really motivated to exercise and be in an exercise study. Um,
Nice.
but I think that's a nice framework if you're already using that to integrate exercise into that structure a bit too.
Mhm. When I teach exercise to mental health to psychology students, Kristin, often the feedback that I get from psychology students who are about to become psychologists and early career practitioners is, how will clients receive this? How will clients receive me as a psychologist teaching them exercise? They don't see me as the exercise professional, as someone who is trained to do that. And like you said, in terms of confidence and lack of training, I think that's a valid concern. I'm curious, do you have a sense of how clients in the therapeutic space receive receive exercise coaching, exercise intervention from the psychologist? Are they like, no, don't do that, who are you to tell me what to do? Or are they generally pretty receptive?
I think if it is a goal of theirs, then they're generally pretty receptive to it. And again, I think it's all about framing. Usually, I'm not telling them, okay, you have to do exactly like 20 squats, and here's how to do squats, and
Yeah, yeah,
let's do jumping jacks together,
yeah.
or things like this. I think I see my role as helping to frame the motivation to get there, to
Mm,
get started, and to keep up with the exercise.
mm,
And I know you've talked about these types of framings with some other guests that I've cited in the past, like Dr. Rhodes and Dr. Teixeira, and Dr. Schuch mentioned this as well. But I think really the best way kind of psychologically to motivate people to exercise is to really focus on the mood benefits of exercise. And again, that like really plays into your role as the expert on mood and anxiety and how we improve mood and anxiety. So I think if we can frame it in that sort of way, it can make us feel more confident because we're really focusing in on how do we motivate people to get to the goals that they already have in the spirit of improving their anxiety and depression or whatever we're treating them for symptoms.
Yeah, fantastic. Yeah. So that framing, that standpoint that you come from, and I like that what you said, right? We're not in a therapy session teaching them, how to the technique for a squat or having, how to increase their bench press, but it's about more of a general how to get from point A to point B and get from that intention to an actual consistent behavior of exercise, whatever that might look like.
Exactly. And it might not be, the 150 minutes of moderate intensity exercise per week, right? Like, that might not be what we're going for. And really in my studies, so I use the framework, I call it exercise for mood. I don't call it exercise for mood. That's Michael Otto, my graduate school advisor, and Jasper Smits wrote the book literally on exercise for mood. And really kind of embracing this framework, which is that idea that the purpose that we're doing exercise for is to improve our mood. And that might mean that, people are just getting out and walking, and that's improving their mood, right? Maybe it's not, this like high intensity interval training that we're aiming to get people to do, but rather just any sort of activity, which again, we're learning more and more that any activity and less sedentary behavior is better than, nothing, right? And more sedentary behavior. So if we can just get people out there to do something, we know that that can improve their mood. And then, of course, maybe down the road, they get all this good physical benefits too. But again, if we kind of conceptualize our role as the psychologist, as the mood improver, it doesn't have to be that we're getting them out to the gym 5 times a week either.
Yeah. And on that note, right, we've touched on this, we've kind of danced around this a lot, and you've talked a lot about things like accountability, and what it might look like in the therapy space. But can you tell us a little bit about, either from experience as a clin psych or in your research side of things, like let's say you've got 5 sessions with a client, or 6 sessions actually, because that's like how Medicare, the mental health system works here in Australia. Anyway, you get a block of 6 sessions, and then you go back to your GP and you can get 4 more, all subsidized by the public healthcare system. But in any case, if you had those 6 sessions, what would you be doing? What techniques, behavior change techniques, or just how would you get someone who is sedentary and who you've agreed with that client that exercise is going to be part of the treatment plan to treat, let's say, low mood, depression? What would that look like in those sessions?
Yeah. I mean, I think where I'd start is where we often start with therapy is psychoeducation, right? And how we're setting up the framework of how we're going to think about, our goals and what we're doing. And that's that exercise for mood idea. And I do think that this is something, it's really based in, I think you've talked about this on the podcast before, these dual process theories of motivation, where we have the cognitive piece, I am interested in exercise is good for me, I intend to exercise, integrated with our affect piece. So how we feel while we're exercising, how we project that we'll feel when we exercise the next time, how much we enjoy what we're doing. And I think that piece, like your previous guests have said, is not attended to as much as it should when we're trying to get people to exercise. But it's something that we have particular knowledge of that maybe a personal trainer or an exercise physiologist isn't attending to quite as much. And so I think where I'd start, and where I often start either when I'm doing this clinically or when I'm doing this in my research studies, is to just set up that idea of, why are we exercising? Because all of us are little rats in our brain. We want to press a lever and get a pellet, press a lever and get a pellet, right? We want immediate rewards. Nice, if our purpose to exercise is because we're going to lose weight, or because we want to get in shape, or because we want to prevent cardiovascular disease 45 years from now. All of those things are really delayed health benefits. They come as you exercise more and more. But I don't know about you. I don't get washboard abs from one session of doing sit-ups. I wish.
2 or 3 usually for me.
Yeah, exactly. But if those are, the outcomes that we're focusing on, that can really lead us to be less motivated to continue with exercising. But what we do know from research is that, many people experience at least some sort of mood benefit, either during or right after exercise, whether that's just like a general mood improvement, or feeling less stressed or anxious, maybe feeling like an energy boost, or even just honing in on a sense of accomplishment for doing something that was challenging, for you. And that can make you feel good too. So those things come right away. Our little rat brain loves that little dopamine hit, that reward that we get from focusing on the mood benefits. And it's interesting because anecdotally, I've had people, in my studies or in my clinical practice kind of say to me that like that feels revolutionary to have that framework. Like they're very used to people telling them, their doctors or, social media or whatever it is, that, if you do this exercise, you'll, for 30 days, like you'll lose 10 pounds or whatever it is. But really have not heard that messaging of just paying attention to how it makes you feel mood wise, psychology wise, in the moment. And that's been something I do some exit interviews and things from my study. And a lot of people have really said that that has helped them so much to like reframe the way they think about exercise, to get more out of the exercise that they're doing. And we're in New York City, so people are walking around all the time, but just never consider that something that could boost their mood, or trying to push people out of the way to get to where they're trying to go, instead of, being in the moment and paying attention to how it makes you feel to be outside taking a walk. So they've really said that that's, helped them just get more out of exercise, but also to just keep up with exercise in a way that they haven't been able to in the past.
Yeah, I love that. Love that framing. I might steal the metaphor as well of the rat and the pellets, because that's really, I
People
think,
love that one.
yeah, it's really applicable and accessible. And I mean, you're so right. You touched on such an important point, right? About, sure, exercise has all these wonderful benefits, but I mean, how meaningful is it to know that you're going to reduce your risk of getting cancer 10 years from now if you do it for 10 years, or diabetes, or even, depression, versus how does it feel in the moment when you do it immediately? Because that's something sure you can measure it, but also you can just feel that as well. It's an accessible benefit. You can feel the next time you go for a walk. You can ask yourself that, reflect on that, versus reducing your blood pressure or your risk of diabetes is something that, you have to go to your GP to measure, and it takes months to get.
And you don't even know, right? Like it's a roll of the dice, some of those things.
Yeah.
So how do you know that I've reduced my risk 1% today of diabetes, right?
Exactly. Yeah. 100%. And you can tie, right, that contiguity. You can tie, okay, I feel better yet because I exercise. That cause and effect is very, very clear if you do pay attention to that.
Yeah. And a lot of us just don't pay attention to it. And I think that's the thing, is if we can direct our clients to just pay attention to how it feels, because I think most of us are busy people, right? We do a thing on our list, we check it off, we move to the next thing on our list, instead of taking just one moment to reflect on, oh, that made me feel good. Good job, me. Congratulations, you exercised today, right? And just that little bit of reflecting on exercise well, paying attention to the mood benefits, giving ourselves credit also, which sounds easy, but is not something we do regularly, can really help us feel good in the moment, but also feel more motivated to do exercise tomorrow, and then the next day, and the next day. Because if we're in a good state and feeling good about exercise, then we're going to want to do it again. And we can use, those benefits that we got from this previous time to project onto the next time too, right? Like we can use that. And I often instruct my clients that's a particular skill, a motivation skill, right? To say, I'm feeling stressed right now. What made me feel less stressed? Oh, exercise made me feel less stressed yesterday when I did it.
Yeah.
Maybe I should try that again today and I'll feel less stressed. So you can kind of bring like the future forward a little bit by reminding ourselves of what we've experienced in the past.
Mm. Yeah, and I love that. And you touched on something really important there as well, where you mentioned that giving ourselves a pat on the back isn't something that we do very often for your average person, let alone someone I think experiencing major depressive disorder with the
Mm-hmm.
particular attributional styles are just, it can be a very negative lens everything is perceived
Mm-hmm.
through. So where I'm going with this is, how do you adapt these things specifically to some of those barriers to exercise that someone, for
Mm-hmm.
example, with depression might have, the anhedonia, for example, which you brought up earlier?
Yeah, absolutely. And anhedonia can be challenging, right? Because it also is associated with deficits in reward processing, right? And this is exactly what we're talking about is rewards from exercise or feeling good from exercise. And the deficits are sometimes in like the actual feeling itself, that it feels a little kind of blunted or number. But also can just be in how we think about how we feel too, and our expectations. And so I think this is where we can try to coach people to not have too many expectations, right, about exercise. Because if they have these expectations like exercise is going to make me feel 100% better, that's not going to work either, right? Because inevitably we'll fall short of that. But if we can coach them to just notice what happens, so not to have expectations like this is going to make you feel awesome, but to say, like, just notice, just like pay attention as you're exercising this week. Just jot down, a couple of things that you noticed after you exercised, how it made you feel, either after or how you were feeling during while you were exercising, and then we'll talk about it. And I think to just kind of like lay it out in that way, more of an observation as opposed to an expectation, I think can be helpful. And then it's similar to what you would do in behavioral activation too, right? Like you'd have them do an activity and observe how it made them feel. And oftentimes it'll make them feel a little bit better. And that's great. And then you grab a hold of that, right? And say, oh, interesting. It made you feel like your mood a little bit better. You felt accomplished. That's really great. How can we harness that and continue with this?
Yeah, love that, because those are really important barriers that need to consider as a
Mm-hmm.
psychologist and as a client, as expectations, like you said. And it's a really, again, accessible way of going about it. Just noticing the next time you do exercise or the next time you engage in your walk to work or to the car, wherever it is, because that's something that anyone can do, is just notice. So love that.
Mm-hmm.
Anxiety sensitivity, Kristin, is something as well that comes up. I think you've done a bit of work a little bit as well. That's another barrier. Can you talk us through a little bit what this fancy term means and why we need to
Yes.
consider that in psychology and
So
therapy?
anxiety sensitivity, it's we would call it a transdiagnostic, kind of a cross disorders process, but it's most commonly seen in anxiety disorders. And the idea, when we say anxiety sensitivity, we mean that people are very sensitive to or find discomfort with physical sensations associated with anxiety. So things like heart racing, shortness of breath, sweating, shaking. So those are found to be uncomfortable, and they don't want to experience those types of sensations or label them as bad. And again, these are particularly common in people with anxiety disorders. We see this most often in people with panic disorder who are feeling all those internal sensations, when they're experiencing panic attacks. And as those types of sensations, like heart racing, shortness of breath, sweating, shaking, all things that can come along with exercise, right? And so we see oftentimes that this can be a barrier to people engaging in exercise, particularly higher intensities of exercise that are more likely to induce those types of sensations. But we also see that if we get people exercising and inducing those sensations, people with high anxiety sensitivity, we see that the anxiety sensitivity goes down over time. And this goes back around to that concept we were talking about earlier of exposure. So we think that, if we can get people to exercise and again, frame exercise and think about it as something that is a comfortable, safe thing that they're doing, they get exposed to these sensations because they're getting brought on in the context of exercise. And then they get to reevaluate the sensations as maybe not being as bad or as uncomfortable as they initially assigned them to be. And so that's one of my current studies, which is my K award, which is like a training award, like a postdoctoral training award through the National Institute of Health here, is looking at people who have anxiety disorders and high anxiety sensitivity, and looking at kind of two different exercise programs. So a low intensity exercise program, and then a titration or kind of step up to high intensity exercise, where it acts kind of like what we do in graded exposure, where we would start them off low and then work our way up. And I think I heard this like go low and slow catchphrase, which we use. I've heard also in like the anxiety context for medication too, like go start low and go slow. So I think it's a similar idea for exercise for people, especially who have high anxiety sensitivity. You want to start them off kind of a little bit lower, get them, again, also thinking about the mood benefits. So as they're getting their foot in the door, and then we can work them up to some of these higher intensities, so that they get that benefit of the exposure to the sensations and feeling more comfortable in the context of them, but not the immediate distaste or discomfort for them, which might come along with if they are being, prescribed exercise by a PCP, they might just say, do moderate intensity exercise, right? And they're like, no, that feels uncomfortable. I don't like that. So this is a strategy to, again, use your skills, which is exposure therapy, right? And to do it in the context of exercise.
I love that. What comes to mind is one of my favorite studies by Sarah Williams and Annie Ginty and co-authors. And this really touches on what you're saying, and I'll come back to it. But they had a bunch of people measure their cardiorespiratory fitness, how fit they were aerobically, and had them undergo a stress test called the PSAT, I think it's called, which is like where they have to remember all these numbers.
Yes.
And they have
it's
to do
not fun.
there's all this social anxiety, stressors in front of a mirror. You're being observed. You're going to be evaluated on how well you're doing, etc., etc. In any case, what they did was they then measured how anxious these people felt, and they found that people with higher cardiorespiratory fitness, higher aerobic fitness, felt less anxious during the task. But what's really interesting is one of the mechanisms that they looked at was this idea of anxiety interpretation, which is that the people with high levels of fitness saw their anxiety, still had the anxiety symptoms, but saw that as facilitating, as helpful. It's going to help me do this task, rather than I'm scared of this, or they didn't interpret them as debilitating. Anxiety is facilitating versus debilitating. And I feel like that kind of is what you're getting at as well, right? With the anxiety sensitivities, that you experience those same symptoms, the heart rate increase, the sensations in your chest, sweaty palms, etc., because they're symptoms of exercise as well as anxiety. But then you can learn that they're not as dangerous as potentially if you only ever experience those same symptoms when the spider's there, when I'm giving a speech in front of 50 people, etc.
Exactly. Yeah. So it kind of it buffers them when you experience them in other situations, right? Like you're able to reinterpret them or reframe them to be not as bad as we think that they are. So, I experienced this during exercise. My heart rate's just increasing. That's not so bad. I know what that's like. I felt that before, right? Because if we're more familiar with something, we tend to, experience it as less scary or unknown, right? The uncertainty, especially for people with anxiety, can be uncomfortable. So as we get people just doing exercise more, they know what it feels like to have those heart rate increases, shortness of breath, a little bit of sweatiness, and it doesn't feel, quite as bad.
Yeah, I love that. Yeah, I think very applicable for people listening who may be going through that, and potentially, who knows, could be a catalyst for some own change in their own exercise and physical activity habits there.
Yeah.
There's a lot
I
more that
will.
yeah, go on.
I was just going to say, I will say that this is something that I learned in grad school from Michael Otto. I'll give him the credit for it.
Yeah.
Is, when you're practicing for presentation, that you can do some of that interoceptive exposure, which involves exercise, right? Like jumping jacks, run in place, get it pumped up and practice your presentation with all those sensations so that it doesn't feel as bad when it's happening, as you're a
Yeah,
podcast guest, for
yeah.
example.
There you go. I think I might be doing that in the next podcast. I'll be doing push-ups in
Yeah.
the corner and going for a run before we jump on and record. Yeah. Well, we've covered a lot here, Kristin, for healthcare practitioners, for psychologists, for clients who may be experiencing, or people who may be experiencing these particular mental health challenges as well. I want to be respectful of time, but also, is there anything finally that you wanted to impart upon listeners, Kristin?
Yeah. I mean, I think just a couple other motivation strategies that I think could be helpful that people can integrate. And these are motivation strategies that are pulled from, again, what we know about cognitive behavioral therapy or motivational interviewing, but we can put them into the exercise space too. And I think one of those that can be particularly helpful is the idea of combining motivations. So if we think that we're all particularly motivated people, that we're just motivated to do lots of things on the list all at the same time. And exercise is somewhere on that list, but maybe for some of us, like a little further down on the list. But thinking about, what motivations are a little bit higher up, and can we drag exercise along the way with those? So for me, my TV shows, especially my trashy reality TV shows, those are very high on the list. And so if I can pair that reality TV show with, I have to be, doing some jumping jacks or other things while I'm watching it, then it makes it a lot more likely that I'll exercise because I'm really motivated to watch that TV show. You could also be like my husband, to give him a shout out. He has a standing bike in our apartment that he plays his video games while on the bike because he's much more motivated to play video games than to exercise.
Love that.
But you can kind of bring that along the ride. But this could be for things like podcasts, like you can take a walk while listening to your favorite podcast or book on tape. It can be, talking to a friend on the phone. So there's lots of different ways to bring exercise along for the ride, and make it a little bit easier to get your foot in the door there. And you can use this as rewards too. So, if you're maybe doing exercise where you can't combine the motivation, but maybe I say, okay, if I, get in my workout today, then I get to watch, my TV show, then that can, serve a similar motivational purpose. But that's something I think we do with other things, but we can, add exercise along with that. Another thing that's like a really common motivational tip is breaking things down into smaller parts, right? And we can do this with exercise. And this I find to be very helpful for people, which is kind of this idea of like mini efforts and making them very, very small efforts. So instead of me saying, okay, I'm going to go from here to running outside for 30 minutes, which sounds horrible to me right now, right?
Me too.
I can just say, okay, just stand up. And I can, there we go. Just stand up. That's easy enough, right? I can do that. And then I might say, okay, now just put those clothes on that are on your bed, which my exercise clothes are, in fact, laid out at home on my bed, staring me in the face, not hidden in a drawer. So that's another way, right? Like that, what we see can cue us into what we want to do. So if I say, okay, just put those on, that's all you got to do. Just put them on. Okay, now I have my exercise clothes on. I'm not work Kristin anymore. I'm exercise Kristin. I feel a little more motivated now to get going. Then I might tell myself, okay, just take a step outside. All you got to do is see the world, see what's happening out there. So I take my step outside. That's easy enough. Then I might say, okay, just take a walk around the block. Oh, easy enough. I can do that. And then maybe I take a jog and so on and so forth. Yeah. Right. Because oftentimes the hardest part is just getting there, right, to the exercise, getting our foot in the door. And so if we can do these little tiny baby things that kind of get us there, then once we're there, oftentimes we're really good at sticking in it and ultimately reaching our goal. But even if we don't reach our goal of 30 minutes of running, I run for 5 more minutes than I would have if I kept that as my only goal. Yeah. Right. And so I think that that's a way to really help people, especially on those days where you're just like, oh, 20 minutes. I don't feel like doing that. But maybe saying like, all right, just 5 minutes. That's all you got to do today. And then that might reduce the wall enough that you can climb over it and get inside.
Yeah, I love that. All those reframes to make exercise more accessible. And yeah, I think in a world, right, where social media particularly bombards us with, like you said, the messages of washboard abs, or you need to do this, 150 minutes per week, the guidelines, etc. That's a really well-needed message about making it accessible in bite-sized chunks.
Yeah. And I think just starting somewhere, right? Like, as opposed to thinking like, oh, the only benefits you're going to get is if you do the 150 minutes a week. You'll get benefits from doing a little bit too. And maybe ultimately you get there, maybe you don't, but you're still doing something, for yourself. Again, for your mood, which is where I frame it most specifically. And then, for the physical health too, that comes all along down the road. But I think really focusing in, we know that you get those benefits for your mood when you're doing it, even if you're a little bit under the guidelines.
Yeah, fantastic. Yeah, this is, again, been really, really beneficial, and it's inspired me to go to the gym and get my exercise in, which is how I like to exercise. So been really, really fantastic to speak to you, Kristin, and I appreciate your time and wonderful words of wisdom. And you have a really nice talent of making complicated, complex concepts very accessible and easy to understand. So I appreciate that, and I'm sure the audience will as well.
Yeah. And I think that's ultimately our job as therapists too. Like if we use all our jargon, then, people aren't going to get out there and do it. So I'm a big proponent of, giving some real life examples. I think you mentioned you've seen some of my talks on pop culture metaphors, which I also very much enjoy, as I told you about my TV enjoyment. But I think all these things, help us to relate better to the people we're working with, and ultimately, have the goals be met and remembered for people too. I tend, as you can see, be very animated also in the therapy space. That's not everybody's, way of going about things. I think you have to be genuine to your own style. But I do think that if you can make the stuff memorable for people when they go home and are planning to exercise later, they'll remember that, wacky therapist that was talking to them earlier in the day.
Thanks so much for tuning in to today's episode of the Mental Wellbeing College. If you've made it this far, it means you've gleaned a ton of value from today's episode, or you've fallen asleep. I sincerely hope that it's the former, and if it is, I would be so grateful if you were to hit subscribe, follow, or to share this podcast with someone you care about. Our mission here at the Mental Wellbeing College is to provide a free and accessible resource for people to take action and implement to improve their own mental well-being. And you subscribing, following, and or sharing helps us to achieve that mission and to impact people in need. Thanks so much for tuning in. It means a lot. We'll see you next week on the Mental Wellbeing College.